and thank you for joining me today. My name is Trista Dantzler, and I'm a graduate nurse at the University of South Carolina, and I currently work as an NPDS at MUSC in Charleston, South Carolina. Today, we're going to be exploring one of the most important aspects of the nurse educator role. So, that will include how we facilitate learning, support learner development, and professional socialization. Whether we work at the bedside or in the classroom, in simulation, or in a professional development role, we play a major part in shaping how learners grow into confident, competent nurses. If you're anything like me, you take this role very serious, and this presentation highlights what that really looks like in practice and what it means for us as current and future nurse educators. So, let's get started. All right, from here on out, guys, I did take my little camera clip away. I just don't want to block any of the content on the slides. This first one here, we have our key objectives. So today, we will be analyzing the key responsibilities of the nurse educator in facilitating learning across environments, examining strategies that support learner development and professional socialization, how to apply evidence-based educational strategies, and lastly, evaluate the impact of an educator-learner relationship. So here we're going to talk about the importance of nurse educators and why we matter so much in our profession. Nursing education isn't just about sharing content or teaching skills. Our influence goes much, much deeper. As nurse educators, we help shape the way nurses think critically, how they respond under pressure, how they communicate, and ultimately how they see themselves in their professional roles. In my NPDS role, I see every day how much learners depend on us, how not only for instruction, but for the reassurance, structure, and modeling of behaviors that are expected in a professional nursing setting. The way we show up during orientation, during huddles, and even in everyday conversations helps to cultivate a sense of belonging and confidence. That's why our role as nurse educators is so impactful. I also wanted to share a clinical pearl that I have found somewhere along the way in my career. The author is unknown, but I think that it is also a very important one to cover, and maybe you'll remember it and share it in the future. So, nursing educators don't just teach skills. They shape how nurses think, which ultimately shapes how patients live. I don't know about you, but I find that clinical pearl quite powerful. Here we're going to talk about core responsibilities of nurse educators. The key functions include facilitation, mentoring, evaluating progress, and serving as role models. Facilitating learning means intentionally designing experiences that help students and nurses build understanding, judgment, and confidence. This includes ensuring psychological safety, making the learner's experience feel relevant, and using adult learning principles to keep the learner engaged. One good example from my own practice is the use of high-fidelity mannequins and simulation. This is an activity that offers real-time feedback and it's hands-on. After the simulation, my team and I also use debriefing strategies to encourage critical thinking and retention of the information. These are all examples of facilitation, mentoring, evaluation, and serving as a role model through simulation and thoughtful discussion. There's lots of other ways you can do this, but this is just one to think about. In Knoll's adult learning theory, we are reminded that adult learners bring prior life and clinical experience into their new environment. Adult learners want to understand why they are learning something, and they need to see how it applies to real-world practices. Adult learners learn best when they are actively involved through simulation, case studies, hands-on application, and real conversations about patient care and past experiences. So, when we design lessons or unit-based education, we should consider a way that focuses on making content meaningful, practical, and relevant. Try to remember, it's not about lecturing, it's about guiding the learner. Adult learners want engaging, problem-solving conversations, not just passive listening. On the slide here, it reviews a couple of Knoll's key principles for effective education, and you can see that they are looking for relevance, autonomy, and leveraging their past experiences. Here we have Benner's development framework. Patricia Benner's novice to expert framework helps us recognize that learners aren't meant to be perfect from the beginning. Novices rely heavily on rules and checklists. Advanced beginners start to see patterns but still need a fair amount of support. Competent nurses take on more independence. As educators, our role is to coach and guide them through these stages, not just by answering questions, but by asking the right questions. When I round with new nurses or when preceptors and I debrief challenging situations, those small touch points help learners connect the dots. Sometimes the most meaningful growth happens in those quick, how's it going conversations, or in a few minutes after a tough shift when they just need help making sense of what happened that day. Here we have understanding professional socialization. Socialization is how learners internalize the norms, values, and behaviors of the nursing profession, and it's not something one lecture can provide. It's an ongoing process, and it happens through every interaction we have, every role model they experience, and every learning experience. If you take the time to observe novice nurses, you'll see that they watch how we communicate, how we solve problems, how we advocate, and how we handle difficult situations. They're constantly absorbing what it means to be a nurse and what it looks like. So, when we teach, we're not just transferring knowledge, but also helping form their professional identity, which makes being a mentor and an educator pretty cool if you think about it. There are lots of different ways and strategies that we can use to support professional socialization. Simulation and debriefing allow learners to practice thinking and communication in a safe environment. Huddles set expectations and reinforce teamwork. Preceptor relationships build trust and help learners feel anchored. Peer collaboration helps learners feel less alone and more supported as well. Knowing that you have someone that you feel safe, that you're able to go to and ask questions is such a relieving thing in a brand new environment, especially in a very serious environment like the healthcare setting. Something I've learned is that consistency matters. When learners know what to expect from us, our communication, our expectations, our presence, they feel safer to ask questions and make mistakes, which is where real learning happens. We don't just teach skills, we create a sense of community. All right, so socialization is a great segue into the educator and learner relationship. This is where we're going to talk about trust and safety. The educator-learner relationship is one of the strongest predictors of learner success. When educators are approachable and supportive, learners are so much more likely to ask questions, admit uncertainty, and seek additional feedback. That level of openness directly impacts patient safety and clinical judgment. I think back to new graduates who pulled me aside privately with questions they were afraid to ask in front of others. That trust only comes when they feel psychologically safe. Our tone, our body language, and our willingness to listen, all of that matters. Educators truly set the emotional tone for learning. Such a key clinical pearl to remember. On this slide, we have a couple of examples of different evidence-based practice models and theories to compare. Our role must be grounded in evidence-based teaching. Resources like Billings and Halstead's Teaching and Nursing, the NLN Core Competencies for Nurse Educators, Social Learning Theory, and the literature on simulation all guide how we structure educational experiences. Using research-backed strategies ensures that we teach not only the content but the methods. This promotes learning, clinical judgment, and long-term retention. Evidence helps us move from simply doing what we were taught to doing what truly helps the patient and provides the best outcomes. Here I want you to think about everything we've talked about today, everything you've learned, and all of the key takeaways that you feel like will stick with you. And then I want you to pause the PowerPoint for a couple of minutes and do a little self-reflection. Consider the impactful educators in your life, past or present, or a combination of both. Then reflect on how you can create a safe environment and implement effective socialization strategies among learners based on your past experiences. So go ahead and give it a pause and do a little reflection. Hopefully you enjoyed the self-reflection. I know it was just brief, but you could also perhaps incorporate that into your daily practice, maybe at the end of a shift, whether it be a good shift or a bad shift, or if you had an experience with a particular learner that you feel like you could have improved on, or maybe something you did really well on. Self-reflect and see how you could build on that in the future. And here on this very last slide, we have all of the references used. If you have any questions, I'm always happy to have discussions, or you could reach out to me directly. I love talking about all of these things. So thank you for listening, and I hope you have a great rest of your day.